ITS in collaboration with ASST Bergamo East, Cardiac Rehabilitation Department of Siriate Hospital. Dr. Santoro, Signorelli, Nespoli, Tori and Giudice realized the course, Telehealth, Televisiting, Telemonitoring and other applications. Module 3, Step-by-Step Actions to Implement Telehealth. Lesson 3.4, Telenursing. In this lesson, we will clarify what is meant by telenursing and delve into telemonitoring and the use of apps in clinical practice. Let's get started. The term teleassistance refers to a professional act within the relevant healthcare profession and is based on remote interaction between the healthcare professional and the patient or caregiver through a video call, to which, if necessary, data, reports, or images can be added. The professional providing teleassistance may also use apps to administer questionnaires, share images, or provide video tutorials on specific activities. The purpose of teleassistance is to facilitate the proper execution of healthcare activities, primarily carried out at the patient's home. Teleassistance is predominantly scheduled and repeatable based on specific patient support programs. What is the purpose of teleassistance? The purpose of teleassistance is to facilitate the proper execution of healthcare activities, primarily carried out at the patient's home. A. Collaboration with the doctor in the management of the disease. Monitoring vital parameters. Monitoring of patient signs and symptoms after therapeutic initiation or changes and in stabilization risk alarms. B. Nursing support. Monitoring of therapeutic adherence, drug adherence and lifestyle adjustment. Health education. Support and monitoring of self-care. Collaboration with the family and community nurse in detecting assistance needs. Telenursing can use remote monitoring tools. What's remote monitoring? Systematic measuring of vital signs and biometric data through devices. Manual detection by the patient, who records the data collected and the symptoms in an app connected to an informatic platform. Automatic data collection and transmission on dedicated platforms by devices implanted to the patient. During the telenursing activity, the nurse views the transmitted data on the platform, interviews the patient, and gathers additional information about their health status, therapeutic adherence, and self-care level. The nurse identifies any clinical issues to be reported to the primary physician or any healthcare-related issues to be managed with educational reinforcement interventions or by referring new needs to the local care network. Telenursing can identify clinical problems to report to the referring physician, inadequate self-care, and provide educational reinforcement interventions if needed. Social welfare issues that can be reported to the local services. The implementation of clinical activity. What does the team need? The first step involves acquiring the necessary skills for telenursing. Specialized clinical skills related to the pathology for which the teleassistance service is activated. Relational skills such as empathy, clarity, and conciseness. It also requires computer skills, knowledge of telemedicine platforms, telemonitoring systems, and cybersecurity. Step 2 involves choosing devices that can be used to achieve telemonitoring objectives, such as the wearable devices and medical records. Step 2 also involves choosing devices that can be used to achieve telemonitoring objectives, such as the ones you see in the previous images. Step 3 involves defining the activation and suspension criteria for the service. These criteria can be clinical and/or healthcare-related or may result from evaluation tools shared within the multidisciplinary care group. When does the nurse activate remote assistance? Patient frailty, for example, low compliance, no caregiver. Low adherence to therapy. Monitoring the effect of a new therapy. Monitoring of vital parameters for a short time. When does the nurse stop remote assistance? Recovery of clinical stability. correct drug dosage and regular compliance with treatment. Patient follows the instructions given by the center, good self-care level. Step 4. The team also needs to have dedicated clinical documentation, such as the use of shared assessment scales within the patient care network and a system for sharing assessments and nursing interventions implemented. The gold standard is represented by the computerized outpatient record. Then some operative aspects. 1. Inform the patient, illustration of the remote assistance service and signature of informed consent. 2. Definition of the intensity level, regularity, type, number of devices. 3. Patient training and simulation. 4. Creation of personal credentials. 5. Planning of interventions. 6. Assistance during the process. 7. Sharing with the team. 8. End of the process and final evaluation. Teleassistance, positive aspects. Continuity of care. Reduction of waiting times. Develop self-care, an active role of the patient. Promote the independence of the assisted person. Promote interaction between the team and the patient. Retraining in the use of devices. Possible obstacles to teleassistance. Lack of confidence with technology. Setting less comfortable. Technical problems. Increased risk of misinterpretation. Clinical case. Hypothesis of activation of the teleassistance course in a patient with heart failure. Male hospitalized patient diagnosed with acute heart failure. Referring the patient to the heart failure outpatient clinic for take charge. Acquisition of informed consent. Evaluation by the multidisciplinary team. Remote assistance activation. Goals: patient education in self-care, detect clinical care needs, provide guidance for lifestyle adjustment, recognize signs of instability, and report to doctor. So, we address these phases. Devices for telemonitoring. Training the patient to use devices. Definition of the path agreed with the patient. 2 contact per week for 1 month. Evaluations. Course of vital signs, level of self-care, and therapeutic adherence, use of validated scales. Sharing with the referring doctor. Continuation of low-intensity teleassistance. 1 contact per week for 3 months, and then a new evaluations moment. If the clinical conditions, self-care indices and therapeutic adherence are adequate, stop teleassistance.